Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Nad wants to know if you could elaborate a little bit on overgrowth of Candida and deficiencies of digestive enzymes with high aluminum being issues that can cause problems.
Where do I begin? Yeah, a lot of our kids have issues with Candida or yeast overgrowth. And of course, that kind of makes sense from a biochemical perspective because we are exposed, or a lot of our kids in the United States are overexposed to antibiotics. We're very, being the primary westernized power, we tend to go overboard with regards to cleanliness and health and all that sort of stuff, especially now. And so as soon as anyone has, let's say, a viral infection, we don't, our doctors, our pediatricians don't necessarily have the resources, I would say. Nobody wants to pay for a culture to be done every time a child has, let's say, a throat infection or something. So we never really discover if it's a viral infection or a bacterial infection. And when we give antibiotics, it improves bacterial infections and it makes viral infections worse. And so over time, though, when you overuse things like antibiotics and or also our diets are problematic, I won't go there. One of the things that happens is that we get rid of all of the bacteria in the gut. And, human beings require a lot of healthy bacteria in order to digest food and other functions. And so when there's no bacteria in the gut or not enough of the right bacteria in the gut, we have an overgrowth of yeast. And that's just a normal thing. It's like when you leave bread out, it will mold, right? It's the same thing that's going on in your gut. And when you have yeast overgrowth, now remember the gut is where the majority of our immune system is, like 80–85% of our immune system functioning depends on the gastrointestinal system. So when there is a lot of yeast overgrowth, there's also inflammation that goes on there. And when there's inflammation or swelling, your immune system is not functioning very well. And so all of this is like a cycle that happens with our kids. Now, lots of other things happen too. So you have essentially, after a period of having a yeast or inflammation in the GI tract, you end up actually having what we call leaky gut, right? So now you start to have things that are the peptides or things that are in your gut start leaking actually into the bloodstream. And now once they're in the bloodstream, they of course start to cause havoc with all different functioning of the entire body, including the brain. So this is one of the issues that we see in our kids, and the overt behavior that we see, and we often, not always, but often when we trace it back, it ends up being yeast, is things like walking around laughing for no reason, or walking around kind of like a drunk person who would, a little bit off balance. Those types of things. And actually some kids, actually, you can even smell the yeast in their hair and on their breath. It's the smell of, let's say when someone has had too much alcohol, right? And you can that there's kind of a weird smell, that's yeast. And so when that happens, oftentimes we will trace back and we'll find, oh yes, there's a yeast overgrowth. Now, when you treat the yeast, there's also a little bit of what we call yeast die-off. There's lots of ways to treat the yeast. Also, we can talk about that. There are diets that specifically prevent things that are high growth yeast. So that's one way to do it. Another is just to give antifungal medications, and antifungal medications vary as well. You can have very light ones like nystatin, or you can have heavier ones like Nizoral or diflucan, which are things that might need, you will definitely need a physician to kind of oversee the process, because as the child's yeast is being treated, they might become sillier before they actually calm down, right? There's this yeast die-off period. But it does, I have seen with a lot of children, personally, I've seen their behavior change once you've gotten the yeast under control. And by the way, it's tough to get yeast under control and keep it under control. So if you are a parent who's dealing with that, do not give up. Sometimes it takes a year or more. Like, you will have to have many rounds of an antifungal medication and stay on the right diet in order for the yeast to actually not grow back. You will need to supplement with massive amounts of probiotics and prebiotics in the child's food so that they are able to regrow that healthy bacteria. But once you do all of this, and as you do all of this, you will see the child waking up a lot of times and just paying better attention, and of course feeling better. So I think it's one of those things that if you are able to determine if your child actually does have issues with yeast, you should treat it. It's very much worth it, and you will see the behavior change.
I'm muted. Absolutely. We saw that in my son, and it was this great mystery to me. When people first said yeast, I thought they were talking about, we talk mostly, when we talk about yeast, we talk about vaginal yeast infections, right? It has nothing to do with it. But it became clear to me, if you've ever baked bread, when you put the yeast in to start it, you have to put a little bit of some form of sugar in with it, because that activates the yeast. This is a clue. Sugar activates yeast. Then you put the gluten in and it activates more, right? And it gets to a point where it's reached how it's going to grow. And what do we do as bread makers? We punch it down. And what that does is it makes the yeast think, oh, we're not going to survive, and it fights harder and it will grow up bigger. So that's exactly what happens in our kid. We put a little sugar in, we put a little gluten in, the yeast goes boom. We try to take it away and the yeast goes, hey, I'm going to fight harder, and it gets bigger. So if we keep starving it from the things, it will eventually go down. But that where you punch the bread down and it comes back up bigger, that's what the die-off looks like in your kiddo. And it is a particularly not fun period in your day or week or month. But I remember when my kid was going through die-off, and I was like, we did this diet and I thought it was going to be better, and it's worse, and we're going to stop this diet. It's not working. And somebody explained to me, no, it's working. You're in die-off. Hang out. And it made a world of difference, you guys. Okay.
I love the example, Shannon, of how you kind of punch the bread, that the yeast, that's so true.